On today's video, I'm going to do an overview on the double cord technique used for the retraction of the gingival tissue for a fixed dental prosthesis final impression. While performing this technique, it is very important to remember some key points to avoid damaging the soft tissues. Tissue must be displaced gently but with sufficient firmness to place the cord just apical to the margin. Not only overpacking should be avoided because it could cause tearing of the gingival attachment, but repeated use of the retraction cord in the sulcus also should be avoided. Both can create some gingival recession. It is also recommended to start on the interproximal area where it's easier to start packing the cord. This will bother less the soft tissues. These two pictures represent how far we should pack the retraction cord into the sulcus for the double cord technique and the single cord technique. It is important to remember that the sulcus, after being displaced, forms a V shape. That's the reason why we pack the smaller diameter cord first and then the larger diameter cord. Notice that the retraction cords have been packed within the sulcus. This way, we don't bother the gingival attachment and prevent any gingival recession. Currently, in the clinic, we use the Ultra Pack retraction cord, which it is fabricated by the company Ultradent. This is a 100% cotton, plain knitted retraction cord. Each clinical case should be evaluated independently for the selection of the appropriate retraction cord. One of the things that we need to pay attention is at the position of the preparation finish line. Clearly, if we have a supragingival margin, we don't need to retract any tissue. But if we have an epigingival or subgingival margin, then we need to evaluate and decide how much tissue we need to displace. The gingival sulcus depth should also be evaluated by gently probing. This way, we will be able to determine if we can pack one or two cords. And last, the gingival biotype, which means how thick is the gingiva around the tooth. Sometimes, when we have a thicker biotype, it is more challenging to displace the tissue. Therefore, we need to select a larger diameter retraction cord. This picture shows us how the second cord should look after being placed. It is important to be able to see it in order for it to guarantee us that the soft tissue won't be in contact with the margin during the final impression. If you did the appropriate technique, you should get an impression of the tooth similar to this, where you can see clearly the finish line and some extra material that went down inside the gingival sulcus. The following are some clinical examples where the technique was done appropriately. This way we were able to impress the finish lines very nice and got excellent results. To finish this overview, I did a small video with the appropriate technique on how to pack cord on a premolar. In this case, I used the 0 and 00 cords. We're going to start by cutting the retraction cord. For this, we're going to open the container and we're going to notice that it has a blade on the inside, which will facilitate cutting the retraction cord. We're going to pull it out and cut the amount needed. Close the container. That was the first cord. the double zero, and then for the zero cord, which is the second cord, we're gonna pull out a little bit more. We want to have a longer cord since we're gonna have a tail that will help us when making the final impression. Then we're gonna take a small plastic cup and we're gonna place just a few drops of hemodent. Just as an overview, the hemodent is a hemostatic solution composed of aluminum chloride. It contains no epinephrine, which helps to avoid tachycardia during these kind of procedures. It is very stable, offers a long shelf life, and it is used for these kind of procedures to control bleeding and other exudates coming from the sulcus. It can be also used for other kind of procedures like when you're doing the actual crown preparation. It can also be used when doing composite restorations. This will help us keep the dental structure drier and achieve better bonding. Can also be used when cementing restorations and on any other kind of periodontal procedures. So we're gonna place just a few drops of hemodent on a plastic cup and then the retraction cords inside. We're gonna soak them completely. Then we're gonna take them out, and I like stretching them out and having them placed on a napkin or a gauze so that it absorbs most of the hemodent. By stretching it out, it will make it easier to pack on the sulcus, and we can notice here where the second cord is longer than the first one. That will help us with that tail that we need for the impression. Now we're gonna start with the packing. Remember that there are special instruments designed for this kind of procedure. We have the serrated and non-serrated instruments. Either one will work fine, and you just need to make sure that you have it on your kit, on your cassette, and use it appropriately. We're gonna start packing the cord, and as I stated before on a previous slide, it's easier to start on the interproximal area. So we're gonna start packing one of the ends of the cord, and then once we get that in, it's easier to move along and continue with the rest of it. You're just gonna continue packing it very gently, very slowly. We're gonna continue, and when we are getting closer to where we started, we want to make sure that we don't have extra material. Remember that we want the two ends of the cord meet each other perfectly. So we can see right over there, that's where we started packing that cord. So we're gonna take some scissors and we're gonna cut that extra cord that we don't really need. And then we're gonna finish packing it, making sure that those two ends meet each other. Now we're gonna continue with the second cord. Remember that this is the cord that has a larger diameter. We're gonna start on the interproximal area, just like the first one, and we're gonna continue very gently along the margin. In this case, the cord will not be able to see from an occlusal view, as I showed you on the previous pictures, but you got the idea of how it should look. It's just difficult to work with a denoform. So you will continue packing. You will go all around the tooth. When you get to the interproximal area, I like going just a little bit more further if the tissue permits it. And then we're gonna have around that amount of cord as the tail to make the final impression. Here's the picture again of how the second cord should look like after being placed. It is very important to be able to see the cord all around the tooth. If you do this on every case, I can guarantee you that you will get a really nice impression. And if you want to do the single cord technique, then you basically need to follow the same principle. You just want to see that cord all around the tooth, and you will get a nice impression. With this, I finished this overview, and I want to thank you for your attention. And if you have any questions, please reach me and I'll be more than happy to answer them. Thank you.